Hey everybody. Most people that come in to see me for a stiff neck or for lacking the ability to use their neck are usually complaining about rotation, the ability to turn, mostly like when you're driving a car, to be able to see in your side view mirror, or you can just turn your head to see things left and right. Rarely do I hear somebody saying, hey doc, I'm having a problem looking up or looking down. So I thought I'd explore a really cool concept today called coupled motions. And coupled motions are not, dance choreography here. They are the ability for your neck to turn requires two other movements to take place, hence the term coupled motions. So for instance, my ability to turn my head is also involved with looking up and tilting sideways. So when I look up, I'm going into extension. And when I'm tilting sideways, I'm just with no rotation at all, laterally tilting. Now why? Well, the back portion of your spine are called the facet joints, and you may have read about these, but the discs that separate the vertebrae sit between the bones. But the facet joints lie on the back side. They're the gliding, the spinal cord's been in the middle. And these are called the gliding joints because they glide upon each other. And in the neck particularly, they're very interesting. The way they're oriented means a lot. They're about maybe 30 degrees to the plane of the ground. And they're basically from C2 all the way down to T1. They're oriented facing forward. And so the ability to turn my head requires those babies to slide on each other. And by therefore sliding on each other, they're allowing lateral tilt and they're allowing extension to allow for rotation. So what's the takeaway from this? Well, if you try to work just on rotation, but you never work on extension, you're really gonna be limiting yourself. Of those three different motions, the most important by far is extension, is the ability to look up. So I want you all to take a look up right now and have somebody in your house tell you the angle that your face makes. Notice mine. And my face should be about parallel with the ceiling. And that's normal flexibility, is to be able to have your face pointing straight up, or about 90 degrees. So if I go from looking straight forward to looking straight up, I should about 90 degrees. Check that out. Those of you that are lacking severely in that are lacking in rotation. So after 25 years of treating necks, just to share with you, work on extension. Understand those coupled motions are a very important part of your ability to turn your head to look into the side view mirror. So lie your head over the back of a table. Allow about 1 minute to go by. Even if it hurts, work on this for about a month's time. If you're noticing a flare-up, obviously stop. If it's getting worse and worse and worse. But I will tell you, it's gonna hurt in the beginning. If you're taking joint lines that have not glided upon each other in a long time because you've been holding a forward head posture. We hear tons about this postural load and this forward head posture. Well, what will happen over time is this curvature of the neck will go away. It'll flop forward. And so therefore, as we age and as our discs degenerate and those facet joints are now jamming upon each other, we're getting more and more of that flexion habitus, that older look. We want to be young, healthy, upright. Work on extension. Work on extension of your mid-back, which will clear your neck. Work on extension of your head, which is looking up. And you're going to see that your rotation ability is enhanced greatly. You'll also start to restore how much tug and how much load on all the musculature in the back that leads to those trigger points and those patterns of pain in the neck and the lower neck. So I hope this helps you out. I hope you enjoyed coupled motions.